Are you tired of waiting months just to understand your own healthcare costs? Well, welcome to this explainer. Today, we're taking a really focused look at how you can completely transform the way you manage your healthcare. We're going to talk about bringing your vital Medicare records online, giving you some unprecedented convenience and, honestly, ironclad security. So let's just dive right into this, shall we? Are you frustrated by all that bulky paperwork arriving in the mail long after you've actually received your medical care? I mean, for decades, beneficiaries have had to just sit around and rely on the Postal Service to understand what their healthcare actually cost and what exactly was billed to the government. And the contrast between the old way and the new way is just night and day. You're looking at waiting a full 3 months for a paper summary to finally show up in your physical mailbox versus getting a monthly digital alert the very second your claims are ready. By going paperless with an electronic Medicare Summary Notice, or an EMSN, you completely eliminate that entire waiting period. Okay, here is our roadmap for today, where we're going to cover 1. Understanding Medicare Summary Notices, 2. Setting up your account, 3. Navigating the online portal, 4. The benefits of going paperless, 5. Troubleshooting and account support, and 6. A quick conclusion and some next steps. Section 1. Understanding Medicare Summary Notices. Let's start with the absolute basics. What exactly are these documents and why do they matter so much to your finances? The most crucial thing to remember here is that an MSN is a record of your care. It is absolutely not a bill demanding immediate payment. Think of it as a really clear, summarized snapshot. It shows all the services or supplies billed to Medicare on your behalf, what Medicare actually ended up paying, and the maximum out-of-pocket amount you might owe your provider. Section 2. Setting up your account. Creating your very own personalized online account literally only takes a couple of minutes, as long as you have your physical red, white, and blue Medicare card handy. You simply navigate over to the Create an Account page at Medicare.gov. From there, you're going to carefully enter your exact Medicare number and your Part A or Part B start dates. Now listen up, because this is where a lot of people mess up. Even a tiny mismatch in those coverage dates will completely prevent the account from being created, so you have to type them exactly as they appear on your card. Once your details are all typed in, you have to verify your identity. Back in March 2026, Medicare actually introduced these enhanced secure login protocols. So you'll link your profile to a trusted credential service like ID.me, Clear, or Login.gov. And these use incredibly strict federal security standards. I'm talking about the exact same ones used by the VA and the IRS, just to ensure that absolutely nobody but you can ever access your personal health data. Section 3. Navigating the online portal. Okay, so once you are securely logged in, you basically unlock your very own healthcare command center. Right from this dashboard, you can track your monthly claims, check exactly how much of your deductible is remaining for the year, and even print out a backup copy of your Medicare card if you need one. But most importantly, you can jump into My Messages and officially opt in to receive those electronic MSNs, which turns off the paper mail entirely. The whole shebang, right at your fingertips. Section 4. Benefits of going paperless. So why even take the time to make this switch? Well, I want you to think about the number 24. By going digital, if you have original Medicare, you can actually review your claims for Parts A and B within just 24 hours of them being processed. You aren't just saving paper here, you are gaining near real-time visibility into your healthcare. And having that kind of lightning-fast access acts as an incredibly powerful financial shield for you. Seriously, billions of dollars are lost every single year to improper payments, and a lot of the time, those are just simple documentation errors. By checking your account regularly, maybe even comparing it against a personal log of your doctor visits, you can instantly spot those errors and genuinely help prevent potential Medicare fraud before it gets out of hand. Section 5. Troubleshooting and account support. Look, we all know technology isn't perfect, right? Hiccups happen. If you forget your password, or your coverage dates don't seem to match up, or you just get completely locked out of your account, what do? First things first, always use the official self-service recovery links right there on the Medicare.gov login screen. But say you are completely locked out, like no way in. The Medicare Help Desk can actually physically mail you a temporary, one-time password to get you back in. It's pretty smart. It uses a highly specific pattern tied directly to the details on your Social Security card, like your first initial, the last 4 digits of your social, and your last initial, followed by a unique code. It's just a really clever way to securely bridge the digital and physical worlds. Now, listen up, because this is absolutely critical. True identity verification only happens when you initiate it yourself on Medicare.gov. The Federal Trade Commission warns that scammers frequently try to impersonate Medicare. Listen to me. Medicare will never, ever cold call you, text you, or email you out of the blue demanding verification codes or your Medicare number to keep your benefits active. If that ever happens, just hang up the phone immediately. Section 6, Conclusion and Next Steps. Just a quick wrap-up note. While we've summarized the facts and federal guidelines for you in this explainer today, the information provided here is really just for guidance purposes. You should always consult official Medicare representatives at 1-800-MEDICARE or speak to a trusted professional advisor to get advice for your specific, personalized situation. By taking control of your EMSNs online, you are proactively protecting your identity, you're reducing physical clutter, and you are defending your wallet against errors. So I'm going to leave you with this thought. What other paper records sitting in your filing cabinet could you digitize right now to secure your financial future? Thanks so much for joining me for this explainer, and happy organizing!